You have a very big role, very important role as Director of TB in Thailand. From your perspective, what do you see as the big challenges in managing TB generally, but also this rather worrying aspect of drug-resistant TB? What are the challenges in Thailand?
In Thailand, we are concerned a lot on about treatment success rate. That means the way to prevent the MDR-TB. If we can have the higher success rate in treatment, we can prevent that. So it comes the slogan 0 and 5 to minimize MDR-TB. 0 means 0 loss to follow-up. And another thing is 5% death rate. We would like to reduce from the average. Currently, we have 7% death rate among TB patients.
Right, those are great targets. What are you doing to make them happen?
We try to have an early diagnosis, because if we can get the patients earlier, the better clinical baseline, and then they get a better result in treatment. So among the HIV clinic, we screen every patient in HIV clinic whether they have TB or not. And also the risk group, like in prisons, in migrants, we have the Global Fund support for that screening. And also we are expanding to the diabetes clinic or elderly people in the community.
Right, you mentioned quite a few risk groups there, then prison populations, people with diabetes and HIV. How important is it to concentrate on risk groups like those?
For the HIV, we found that 15% of tuberculosis patients are HIV infected. So that means if we can find them earlier, give treatment at the early stage, we can get a cure rate higher. And for the elderly people, we found from the prevalence survey that nearly 40% are elderly people. So it means by the aging population, we found tuberculosis patients in the older population.
And with diabetes?
Diabetes, it's like a coincidence with the aging also. We found the higher rate than the average of population.
And in prison populations, they must be easier to look into because you've got them all in one place.
Yes. In prison, it's really crowded. We found 7 to 10 times higher rate of tuberculosis than the general population. So we have the NGO collaboration working with the prisoner, and after release, we try to track them to follow up and give complete treatment to them.
Now, in theory, you know what to do. In theory, you know how to treat patients, but practically, actually doing it, what goes wrong?
The problem right now is the transportation is really convenient in Thailand. The population, even Thai population, they migrate from one place to another place. So sometimes the loss to follow-up still high in some setting, in some area. And including the migrants. The migrants, they work from this building site to another site, so the follow-up is not so good among those population.
And your universal health care in Thailand, how helpful is that in the face of a TB threat?
Yes, it helps us a lot because it reduces the barrier of how to access to the system. For Thai population, we have no problem because they can get diagnosis and treatment for free. But for the migrants, it is in the early stage. We are going to have the health insurance scheme for the migrants. But you know that for documented migrants, they are willing to join. But for the undocumented, sometimes we need more effort to get them to the system.
Now, coming out of your experience in Thailand, what few practical messages would you leave doctors, clinicians and communities with? What advice would you pass on about how to deal with TB, especially drug-resistant TB?
The message to all those audience is about the early diagnosis. Get start treatment and complete treatment. Sometimes I would like to emphasize on the word complete treatment, because in many diseases especially for the acute disease. Just start, it means maybe just only 1 week they can finish. But for tuberculosis, it means 6 or 9 months or more than that. So not only start treatment in many settings, especially like some clinic or private service provider, sometimes they can start treatment easily, but the way to follow up and get complete treatment, give complete treatment is not easy.
So in just 5 or 10 seconds, what's the take-home message coming out of your experience?
Fight, treat, and cure tuberculosis. That is the message.